so there's going to be something there.
Just to get us synced up. Thank you.
There we go.
So I don't know what happened to people. Hey, Justin, thanks for coming. I
Okay.
don't know what happened with people that use the link. Did you come in via the Green Party link, or how'd you?
Me? Oh, am I in the wrong place? Yeah, I did come
Nope,
in.
you're in the right place.
I
You're
came
in the
in through
right
the
place.
I RSVP'd on the Green Party site.
Okay, cool. Very cool.
I
We're
use
we're
the
still
other
getting
link.
everything.
I use the
What's that?
other link. Um, I think I use the some other link. I don't think it said Green Party on it.
That's okay. I think as long as everybody's getting to the right place, we're good. you know. So let's see who all. I think. Oh, I need to get Veronica on. We're waiting on Veronica. But yeah, I think we're ready to go whenever. Let me just make Justin. I'm gonna make you co-host. By the way, there's two Justins, guys. So Justin Sindall is going to be helping us with the tech end. And then we've got Justin from Connecticut, who's also a candidate. And if you guys want to change your, do you want me to change your handles or anything? Are you good?
What do you want our handles to be? And are you gonna, is everyone's sound okay?
I think so. I can hear everybody so far.
I'm checking one thing to make sure that I can put my camera on Zoom and not be on a separate thing here in OBS. So that should allow me.
I'm just happy.
There we go.
We had like two options. We were either going to go via Facebook or we were going to go via YouTube. And so, I think it's for us, at least those of us that kind of have to do more stuff independently, it's better to have this kind of experience, you know what I mean, and set up. So that way, I don't know, it makes it easier to do it, on a regular basis.
All right.
And I had a YouTube channel, but I haven't used it very much. So I have 6 subscribers as of yet, but I'm going to post the link publicly for people to watch the stream. And then Felina, if you could just help kind of moderate and, are you able to chat and just kind of keep us moving along smoothly?
Yep, I got you.
Awesome. Thank you so much.
Okay, I can
great.
pull up, if you can drop that YouTube link, I can pull that up on my other screen here.
Sure. Mm-hmm.
And that
Let's
way I'll have that chat going on the big window here. And
where's Veronica? I didn't share screen with you yet.
Here.
I'm sorry.
And I got my panel behind me here on behind camera side, so we should.
Okay. You know what? I have to do that through my phone, actually. Okay. Let me see about. This is why I need tech training.
'Tis the season for cranberry ginger ale.
All right. I think I got you that link. I'm going to close that down. One more thing. And co-host.
I am going to have to do this the hard way.
And I'll let you guys know when we start recording, okay? So everybody's ready. Everybody doing okay? Got your beverages? Okay, good. And I'm just going to text Veronica.
All right, here. I'm going to copy this link into our Zoom. This is for everybody to put out there. This is the YouTube link, folks. That's the live one.
Okay. I'm going to send that and then I'll start recording. So that's good with everybody?
Excellent.
Cool.
I'm going to tweet one thing. I want everybody to get one of those retweets out there. And
I'm coming. I'm going to do it right now and then I'll start recording.
I'm about to drop one here. And
I didn't need to know that.
No, yeah, I know, right? Yeah, so
I'm
we
here,
can get a little bit
Delilah.
of hype on this thing.
Hi,
That'd be nice.
Veronica.
Hello,
Girl, you won't
everybody.
believe what happened. I was
Oh.
leaving the store, and I forgot to close my trunk, and somebody stopped me at the light and said that my stuff was on the ground, so I had to stop, and they put it in the car for me. So I was thankful.
Oh,
Yes.
good.
Yeah,
Good
yeah.
Samaritans. I'm
How
so glad.
are you?
Good. I'm good.
You
You
look
know.
fabulous, by the
Oh,
way.
thank you. Thanks. Lighting.
Delilah, I am sort of doing two things at once. I'm sort of bathing my 4-year-old and doing this,
Okay.
so I can hear you fine and respond fine because I have
Okay.
this nice little headset thing. But just so you know, like if I'm in the middle of something wet, I may have to like mute my phone or mute my my headset here. So just so
I
you know.
totally get it. I got a 6-year-old.
Hey, we're just glad
do
you
your
you
dad thing. I'm gonna start recording this. Hopefully everything is fine.
Recording in progress.
awesome.
You'll let me know
Uh,
if you have any glitch issues or anybody's having issues at all.
cool. Well, if we're ready, we can fade it in and we can
Yep.
start on the YouTube here. As long as people are still sending out their tweets, I'm trying to send mine here in the front so everybody doesn't get my forehead. Alrighty. There we go.
I like the cowboy hat, Justin.
Thank you. We gotta look appropriate. All right.
Okay.
Now, and I'm gonna fade us over here in about 10 seconds. Just pull back up OBS
Countdown.
and close out that. And we're going in 3, 2, 1. Hello, everybody.
Hi.
Hey y'all, welcome to our Medicare for All panel. I'm really excited about the group we have today. We're all here to share our experiences and share solidarity for the cause, which is universal health care, which we all need. And yeah, I'm gonna go ahead and just help co-host and move things along. Let me introduce myself. I'm Delilah Barrios. I'm a candidate for governor in Texas on the Green Party ticket. And yes, Medicare for all y'all is what we're calling it here. But as a healthcare worker, you know, it's really important to me that people are protected and cared for. So that's why it's important to me. I'll give you all a moment to introduce yourselves. Justin from Connecticut, if you would go next.
Sure, thanks. I'm Justin Peglino. I'm in Connecticut. I'm running for U.S. Congress, U.S. House of Representatives in the 3rd District of Connecticut, which is New Haven and surrounding area. And Medicare for All is one of my top issues that we decide I wanted to run so that it could be on the ballot. Because the Democrat Rosa DeLauro doesn't support it, the Republican doesn't support it, and so if I weren't on the ballot, there'd be nobody on the ballot you could vote for to show your support for Medicare for all. So I thought it was a really important thing to do because it's as we'll talk about, I'm sure it's a vitally important reform that we need in this country. But I'll leave it at that.
Matthew.
Okay. Hey, everyone. I'm Matt Ho. I'm running for the U.S. Senate with the Green Party in North Carolina. Like Justin, if I wasn't running, there'd be nobody arguing for universal health care, single payer, Medicare for all, whatever you want to call it, for putting people over profit in this race. No one else. I mean, it actually throughout North Carolina, of the 15 federal seats that are up, there are only 2 of us out of Libertarian, Green, Democrat, and Republican Party candidates running for 15 seats. Only 2 of us are actually, running on Medicare for all. I'm doing it because I have a lot of people in my life who have to call the doctor. Who have to call check their bank account before they call the doctor. So I appreciate being here, and I look forward to this conversation.
Thank you. Veronica, do you mind introducing yourself?
Of course, I don't mind. Can you hear me?
Yes.
Okay. Hi, everyone. My name is Veronica Fimbres, and I ran for the insurance commissioner in the state of California for 2022. I belong to the Green Party, and my goal was to introduce Medicare for all to the state and make it happen. And unfortunately, I didn't get any of the play that I was looking for. None of the I made history by being the first Black trans woman, nurse to ever be on the ballot, and nobody knew I existed. Nobody knew what I was standing for. And the people that it was very frustrating. But the worst part is that they adore the corrupt almost criminally corrupt incumbent. And so he's on the ballot. My gig is up. I lost in June and I no longer have anything, but I'm still a nurse and I'm still striving to have Medicare for all. They were going to call it CalCare here, but it's called nothing because no one passed it. So we need, as a nurse, I fight for patients that don't have health care. I have had to argue with insurance companies. It's not cute. So if I ever become, and I would like to run again, if I ever become insurance commissioner, I'm going to make that happen. I'm going to turn the insurance industry in the state of California upside down and shake it out.
I love that.
I check in.
Thanks.
I could go next. I'm also in Cali and had the same sort of experience of, unfortunately, being in a state that's supposed to be one of the most left-leaning, and we literally had CalCare at our literally like one step was the vote, and just how that collapsed was just very disheartening. So I'm speaking for, or I'm here for the people who don't have insurance, because I have insurance through an employer right now, but before that I didn't have insurance for like 8 years. And having insurance through an employer does not mean you go to the doctor. That just means if you get really ill, you have access to pay a couple $100,000 to maybe stay alive for a little while longer. That's really what our healthcare system is not really designed to make us healthier. That's not the goal of the system. So that's why I'm here. I'm here speaking for those that don't have healthcare.
Thanks so much, CJ. Liana?
Thank you for putting this together, Delilah. I really appreciate it. My name is Liana West. I am running as an official write-in for the governor of Arizona, and I do have the endorsement of the Arizona Green Party, the Pima County Greens, and also the Maricopa Greens. So I'm super excited to be representing the Greens here in Arizona. As far as Medicare for all, Arizona is at the forefront of, well, we're close to California in the amount of medical debt that is mounting here and is actually affecting daily lives of Arizonans is becoming a real crisis. And the homeless situation here is at such a crisis that one of my opponents has claimed that the unsheltered individuals are choosing to be unsheltered. And it has become a real war against not only the working class, but anyone who finds themselves at the poverty level or below the poverty level. So Medicare for all would be critical for my state. It would be critical for everyone across the United States. So I'm really excited to be part of this panel. Thank you.
Teresa.
I too am glad to be here. Thank you for including me. I'm a citizen advocate for Medicare for All, and I've worked with the March for Medicare for All since about, well, springtime of 2021. I'm the lead organizer for the Phoenix metro area, and that's also representing Yellow Vest Actions Phoenix. My vision is that there's a sea of yellow communicating our message in a non-violent way, but being loud and being seen. So far, we have yet to garner any media attention, only our own. So I keep going. Recently, I've been diagnosed with my own big medical news. I was diagnosed with breast cancer on September 15th. It was very shocking. I'm a very active person, very healthy person. And I had surgery on the 3rd to remove my tumor and also lymph nodes. And I've been learning a lot. And I consider myself one of the lucky ones because I have insurance. And later I'll share some specific moments that don't show us in our best light.
Thank you so much. Justin, Felina, do you want to shout out or do you want to stay anonymous?
Hi, I am Felina Farley. I'm the National Media Co-Chair and the National Black Caucus Co-Chair and Ohio Co-Chair, and I spoke at the Medicare for All rally here in Ohio. That's where I met Misty, and let's see, I earned my red beret.
Nice, very cool. All right, last but not least, Justin.
Yeah, hi.
You want to share why you're here?
Yeah, I'm Justin Sindel. I am the membership coordinator for the Maryland Green Party. I was involved with the March for Medicare for All here in DC, not this year, but the previous year. I'm an advisor with Delilah for Texas, and hopefully bringing some facts, figures, and dealing with some of the technical and the back end support here tonight. So hopefully we can have some really important discussions about what it means to actually have some candidates when they say that they believe in Medicare for All, they actually mean it, and what that actually is going to look like on the state level as well as on the congressional level.
Absolutely. And thank you so much for helping us, both of you, for helping us get this put together. Right. I too, I've been an activist for a long time. I take my kids to direct action events, and, we do the petitions and we sign the letters and we show up to people's offices and things like that. And, at some point, I think most people can agree that we are not as effective as we would like to be, and these movements are at a time like this so very important. And the fact that, the people that you're going to find talking about Medicare for All still are Greens. It's not anybody else. It's Green Party or Independent. We're the only ones who are willing to fight this fight and continue it. And so, I think it was really hard last year because I had declared as a candidate. It was in the summer and it was with March for Medicare for All. I ended up being the lead organizer for Austin, Texas. And, I was trying to be very bipartisan, and, we're like, go ahead. And if you want to come, Democrats or whoever, come speak your mind. It's fine. We're just happy for the movement to be continuing. And, I was really the only one that did that. And, it honestly was very disheartening because that it's a popular policy, and that every single person I know has had some poor experience in regards to healthcare. Not specifically, you know, oh, they didn't like their provider, but something bad happened to them and they struggled because of our unjust healthcare system. It's very inherently, you know, racist and classist and costly, and you know, it does more damage than good. So it's important that we're continuing this fight. And I think that hopefully what we can do is inspire more people to continue it. Matt, do you want to add more?
Sure. I mean, I think, you know, Veronica, I know you're a veteran. I'm not sure if you use the VA or not. You do? Okay. Yeah. So I think Veronica and I have the perspective of what it would be like to not have to worry about cost, right? To be able to go and utilize your doctor, get the health care you need, get your medication, something's not right, to, you know, not have to check your bank account. I mean, I've, you know, here in North Carolina, an affordable health care plan is $250 a month for the premium. That's an affordable one with an $8,000 deductible, right? I mean, like, so if you make $20 an hour and you get 40 hours a week, which most people don't get, right? But say you do, that's 36 grand a year. But your healthcare plan is going to cost you 11 or 12 grand. I mean, so how is that affordable? And that's, I think, going across the state on this campaign, healthcare is one of three things I've heard everywhere. The other two are housing and drugs, the incarceration and the overdose aspects of it. But healthcare, housing, and drugs, I hear everywhere in North Carolina. And it's a big state, and I hear it from everyone we talk to. But this, for me, with what I deal with because of my time in the wars, time in the Marine Corps, one, I wouldn't be alive if I didn't have that healthcare, and two, I certainly would not be able to do this. You know, I wouldn't be able to do anything because I have a brain injury that if I don't have the right medication and care for, I'm completely debilitated. So, I mean, for me, it's been life-saving, life-changing, life-giving. And the fact that I don't have to, like, pick this up, open up my bank app and look to see how much cash I have before I call my doctor or request a change in medication. I mean, there's all kinds of benefits that I have and that allow me to live fully and completely and thoroughly, and allow me to do things like take a risk and run for U.S. Senate. That, you know, if we were to extrapolate that out and give that to everybody in this country, the transformation it would be, just the economic, not even considering the moral piece or the justice piece of this, but the economic transformation that would be for this country would be, I mean, it'd be a revolution. So I think that perspective that I have, and you know, if I can speak for Veronica as well, she has, of having healthcare, having access to it, not having to worry about cost, is something that is, you know, it's life changing for me, life giving for me, transformational, etc.
Oh, you're on mute. Hold on. I can't.
Can you hear me now?
Yes.
Thank you. Like Matt said, the VA, I'm glad he mentioned the VA because the VA helped me incredibly. I went through military sexual trauma and I was in the Vietnam era war. And without it, their therapy helped me be able to talk about what happened to me. And one of the things that's really important is that they cover everything. So Matt is right about no worries. I don't have to worry about prescriptions. I get the best care. I'm wearing Invisalign braces. These are from the VA. These are from the VA. So I get perfect care. Everyone deserves that same level and quality of care. And the first person I showed my signature sheet to and said I was running for insurance commissioner, the doctor took it and signed up and also donated $50 to my campaign while I was standing right there on the ward at the cardiac care unit because my friend was there. And so everybody wants it. Doctors are fighting to get this as well. I'm on a group with the physicians and nurses. The only thing that was disheartening for me is, I guess in California, the nurses were more elitist because I wasn't an RN, then my gravitas, I don't have any pull or anything. So they thought, but nonetheless, it would help everybody to have that same quality and same level of care. And I fight for it all the time. I fight for my patients when I deal with insurance companies and have to fight. They're trying to tell me that they don't need it. And when it's life threatening, I mean, these people don't even have any idea. That was another reason I was running for insurance commissioner, to turn the whole place upside down, because they don't get it. And until they do, until we get everybody having Medicare for all, we're going to be in the boondocks. We're going to be a backwards country still.
Yeah, and can I add one more thing to that, because I do peer support work. So I've worked with a lot of guys that were in really bad place, like I was. I mean, I was suicidal and from the wars and everything else. And if not for the professional care I got from the VA, I'd be dead. I would have put a gun in my mouth and blown the back of my head off a long time ago. And I've worked with a lot of guys who, only because of that level of professional care, are still with us. Right. So what that has saved so many families, the horror of that and everything else. And it's because they have that access to professional care, like Veronica was saying, that, again, what we see in this country with people being denied that because their bank account's not full enough or they don't have the right job. It's criminal. It really is.
And that's how healthcare to a job is wrong anyway.
Yeah.
Because if you lose your job, you don't have health care.
Right.
Yeah.
I wanted to add something about the VA, since you brought up the VA. I had some experience doing rotations at the VA in West Haven when I was a resident and in medical school. I think, the next thing is maybe going to be VA for all, because right now we're looking at, we're talking about Medicare for all. And the people are behind that, and the Green Party is leading on this issue. But that takes the profit motive out of health insurance, where it's has no place, and where it's.
Oh, give it a sec.
Justin, are you still with us?
Skewing priority.
You're gonna have
What's
to.
that?
Can you
Well,
start?
cut out a little bit, man.
Oh,
Yeah.
I'm sorry. I may have to get my kids to turn off their internet.
It's okay.
Can you hear me? Okay.
Yeah. Go ahead. We can hear you.
I was saying that the profit motive in health insurance is what's causing so many people to be unable to afford medical care. With Medicare for all, okay.
And I think it's happening again, at least on my end.
I'll have to come back. I'll be back.
Okay. That's okay. Yeah. Totally fine. I'm just going to go ahead and share that one of the things, so I've worked in healthcare for 19 years as a certified surgical tech. So we do trauma surgery. I help out in the surgeries. And I've been doing that for a really long time. And I remember when Obamacare came around and everybody was like, it's going to be great. And I remember it not being so great for a lot of people. And there's this patient that I remember, and I will never forget this patient because of how their story resonated with me as somebody involved with their care. And I think it was either when I was contemplating having kids, which is in this health, like, it's so expensive to have a baby in this country. Like, it's crazy. And there's just so many issues that I don't think I really was aware of it when I first became a mother, but I was young and this person was a mother and they were having some pretty important surgery where we had to take frozen sections and, check for cancer and how far was it spreading and things like that. And I remember before she went to sleep, she was like, well, how long is this going to take? Because I can't stay the night. I need to go home and take care of my kids, my babysitter's going to leave. And, I was like, oh, how many kids do you have? And, and we chatted a little bit. And then throughout the procedure, learning that her diagnosis was at that time just only getting worse and more severe because, this is our first time kind of really trying to identify how bad it was. And I just, I think about that person every single day because I don't know how badly we failed them in this process. And I went to school to help people. And it really felt bad to think that we weren't really able to meet their needs. We weren't really able to provide what they needed. And I think that really woke me up to how bad the system can be and how many victims of capitalism there are, basically, because this for-profit model is actively killing people and harming them. So I don't know that this stream will go anywhere because of all the things that we're talking about, but they're so important. And, I'm going to, it's being recorded and I'll send it to you all too after. But yeah, I think that we are all pretty much aware that there's a desperate need for change. And I'm happy to be in this fight with all of you. Yeah, go ahead, Teresa. Thanks. Oh, you're on mute. There you go.
My husband is an RN, case manager with the biggest medical provider in our state. He sees a lot. It's opened his eyes. And he tells me about the uptick in disease diagnosis at age 65. People are living with their illness because they can't afford to get it diagnosed. And, my cancer was found because of a routine test ordered by my primary care physician. We caught it fast, yet it was still quite aggressive. People are dying because they don't have preventative care. That's barbaric.
Yeah, I absolutely agree with you. It's a cruel, inhumane system that we're involved in. Sorry, Justin, did you want to add something?
Well, yeah, just me, Justin. Yeah, I just wanted to add, can you hear me okay, that
Yes.
there's if you look at life expectancy, and for people, when if you make it to 65 and you get on Medicare, your life expectancy lines up with people in other countries. But before that, there's a gap. And that's because, our healthcare system only kicks in and meets the standards that other countries are meeting when people get on Medicare, when they reach age 65. So we need to extend that down to 8 years of age. And the point I was trying to make earlier is that, I heard a story about pediatric centers closing and these major medical centers, deprioritizing low profit models of care. Like pediatrics doesn't generate as much profit for a hospital as say cancer care and surgery. So they don't want to invest as many resources in it. They're operating like a business. They're not operating based on what people need. They're operating based on what's going to make profit for the hospital. So it's affecting care for all of us. They're shutting down pediatric centers and they're not meeting the need. So it's just another example where the profit motive has no place and is affecting us all negatively.
And I want to chime in. I don't think we can't settle, like, if we get to a point where they want to, well, let's do some sort of mashup, private, cover everybody. Then what happens if we do that is it's terrible service, and it's to the point, or to that point, if we look at our healthcare system now, it's not to deliver better health. It's to deliver profit. I mean, you have people that's denied coverage on a daily basis over technicalities, and just luckily a lot of them don't, or, may not have life-threatening illnesses. But that is the state. If we're in a system that is providing health care, how can missed payments stop that health care? You get what I'm saying? Like, that means
Yes.
we're not providing that. That means because of a missed payment can stop that health care from being provided to any person. That means that we're not providing health care. The other thing I wanted to chime in on is this notion that if you have healthcare, this healthcare that you're being covered, oh, let's just expand, Medicaid. Let's keep in mind, Medicaid requires you to be in a perpetual state of poverty. That's the part they don't like to, because they want to, yeah, Obamacare, we got this out of it. But it's like, well, that person, in order to qualify for that, they literally have to re-qualify for being some of the poorest people in the United States. Because I used to have to do this every 12 months, providing all this paperwork. It's basically mean testing poor people who need it the most, out of healthcare and out of other services. Is really quite I don't know if the right word is sadistic, but it's really quite amoral and immoral.
Oh yeah,
have that type of system.
Absolutely. It's not focused on health when you're focused on money. That's why our quality of life is going down. I'm going to give Liana a minute. She wanted to add some, need to just make sure everybody's got time to speak.
Thank you. And I want to just elevate what CJ was talking about. And I know that everyone here understands what a for-profit healthcare system is, but for our listeners, a for-profit healthcare system means that someone is profiting every time you are sick, or you go to the doctor, or you go to get your kids, give their vaccinations for going to school. So everywhere along the chain, whether it's emergency care or preventative care, someone is profiting off of you every single time. And that's the part that is unfair to everyone. That is what is hurting all of us. It is that extraction of that profit that is preventing those of us who cannot afford the health care. It is absolutely just pricing us completely out of the market. So that's the end result of a for-profit healthcare. There will always be people who can afford healthcare, but the phenomenon that we are seeing here recently in the last decade is that the amount of people who are unable to afford even just going to the doctor once a year has dramatically increased. So the amount of people who can enjoy going and having their teeth cleaned, that's something that every person should be able to have at least once or twice a year. And that is just not an option for a large part of our country. And I think that's hard for people to admit. And it is hard as Greens when we see what's happening, and there are so many people who cannot see it yet. And I think that's where our level of frustration comes from a little bit. I also wanted to speak on the part, what Justin brought up real quickly. He brought up that we should have VA for all, which I completely agree. The model should be that a person is able to go and get the care that they need, regardless of what the cost is. As a society, we have enough people to absorb that cost. And it is only when we're able to remove that profit motive from our healthcare system, that we will be able to have it. Over.
I think you could go ahead, Veronica, but you need to unmute.
Okay, am I unmuted now?
Yep.
Okay. So as a nurse, I've worked at 3 VA hospitals, one in the Bronx, at Kingsbridge, and at the VA hospital in La Jolla, California, and at the VA hospital in Palo Alto. And I remember telling the VA and telling my director that we could save a lot of money by turning the VA system into a green system, because it's one of the largest hospital systems in the nation and in the world. And so if we turned it green, so I told them how they could do that. I helped break it down by getting rid of plastic and styrofoam cups and in the cafeteria and all that stuff. And they were all for it. And then came the issue of money, and they scrubbed it. They did not want to be bothered with it. They didn't even want to talk to me anymore because it was about money. And when you go to reach for a patient, and you go to the med card, and get a pad, and somebody tells you that you can't use that pad, those are the expensive ones. Use one of these. No, you use the same quality for everybody. You give them the very best that we have, and don't put a price on it. That is a 25-cent thing. So all this for-profit stuff is just absolutely ridiculous. And because money is more important than people to the corporations and to the people that we're running against, that we're fighting. We're fighting for everybody else. That we're fighting for the 99%, because the 1% isn't able to care about us. They only care about money. And that's unfortunate, because I've had patients where I've had to walk them out and talk to them and break bad news to them, and or they couldn't afford a treatment, and the insurance company out with me, and they cried their heart out because it's unfair.
Can't even imagine.
Thank you. Justin Sindel, you wanted to add something? And we have another topic if you want to. Oh, okay. Go ahead.
Yeah, I just wanted to make a comment about the Medicaid problem too, because there's a lot of corruption with Medicaid, because there has been a lot of, outcries or whistleblowers about certain medicines being given to, or treatments being given to Medicaid recipients versus private insurance recipients. One of the cases where the childhood vaccines are kept in one refrigerator for Medicaid, and the private insurance vaccines were kept in another refrigerator. And only a few health practitioners question that. If it's all supposed to be the same medicine, why are they in separate refrigerators and separate temperatures? And that stuff is not being talked about a lot when it comes to Medicaid. And another point I wanted to make about eating the rich when it comes to Medicare for all is I always try to mention that let's not forget, if we do Medicaid for all, we also have to release the thresholds for flexible spending accounts and health savings accounts, because those have thresholds. And if we do want the system to self-pay for it, we'll have to lift those thresholds, because I think flexible spending accounts are like $2,000, when very wealthy individuals could put a lot more into their flexible spending accounts. And it doesn't roll over, and it could go back into the pot of Medicare. So that is another reason why I always mention that when it comes to eating the rich that can afford the healthcare costs. So that's
That's
it.
such a great point that she brings up, because a lot of people don't know, the average American don't know that there's caps.
Hmm.
And I think what is it? I think it's like 137, 140,000 or something like that now. And if that was just lifted, just think about that. A person, all these celebrities they're making these millions of dollars. This is capped at the same price of a person that's making, you know, 200, $300,000. It's ridiculous. So just lifting that cap would infuse and provide money. But this is another great point, in that I think we use the term Medicare for all just to mean healthcare for everybody. I don't necessarily take it to mean we're actually using the same Medicare system that we like, the way it's set up now. I'm more of a fan of nationalizing healthcare, but I'll take, Medicare for all as a way towards that, as long as everybody is covered.
Yeah.
But yeah, just to so maybe we shouldn't think of it in that way. So when I say we should lift the caps, I'm thinking of it in the way that of the old system. But if we're talking Medicare for all, I'm thinking, or I'm assuming we're talking about envisioning a completely different type of system to deliver care. Because if we take the profit motive out of it, I think that would take the caps off of it.
I
Can I
think
just
let's okay, go ahead.
Oh no, go. Well, I was just gonna say. I mean, yeah, Medicare for all means different things to different people. I mean, to
True.
me, what it would mean would be no cost out of pocket for anyone to get health care. Including eyes, ears, dental, including needed in-home services, no cost. And again, the analyses that have been done on Medicare for all, and they define it a few different ways too. But the bottom line is studies come out and tell us that it's less expensive than the current system by about 10 or 15% as much. And so we'd be saving hundreds of billions of dollars a year. And if we need to use some of that money to make sure that it's as comprehensive as possible, we could spend that money on better care and still break even. Um, but and when people ask how to fund it, I say, well, it's first of all, it's cheaper, but second of all, the best way to fund anything that's provided by the federal government, in my opinion, is progressive income taxes. I don't think you need to be docking anyone's paycheck for like Social Security, Medicare taxes the way we do now. I understand there's a logic to setting it up that way, but I think the fairest way to raise revenue for the federal government is progressive income tax, just a higher percentage based on your income. That's my opinion.
Yeah, I think it's kind of important to note, for example, um, Delilah mentioned about Texas in specific, being Texas is as big as it is. It would be the ninth largest GDP if it weren't if you know factoring in the rest of the United States. If you broke it off, it would still be the ninth largest GDP for countries. So a state as large as Texas could absolutely implement a statewide Medicare for all and still get to a significant chunk of that savings that you would see on a nationwide program because it is so big. Because you're right next to Mexico and potentially, you're right next to Arizona, you could potentially also set up an interstate kind of deal where other states who want to participate in a single payer program can set up their own partnerships in their regions, cost sharing, and possibly procurement of supplies as that is needed, as we've seen with our supply chain crisis of 2021/2022. I think it's now more than ever we see we might have to actually start to rely on the states to hold on to some of that stuff if we ever have a serious logjam problem again and we can't get medical supplies, we're going to have serious issues. That's something that a Medicare for All single payer system should be able to handle, where they would be able to stockpile enough medical supplies in case of a shortage like that. And
Yeah,
Delilah,
absolutely.
you mentioned our next topic here. If you want to reach that to the group here.
I'll do it. Okay. So listen, healthcare is not about the whole patient. It's not about the whole body. We already talked about how they don't want to insure your teeth or your eyes, and they want to separate your healthcare from your general welfare. And one of the issues that I have in Texas is that SB 8 passed last year, and the Democrats did not want to talk about it until they got closer to midterms. Meanwhile, we've got patients bleeding out, needing to be shipped off to other states, and we do not have a way. If you talk about being compassionate and caring about the life of the mother and the life of the child, it is completely hypocritical to treat people in such a manner that they don't have autonomy over their own bodies. It's insane. I know too many people who have suffered under these barbaric systems and laws. And so, that's another thing that I talk about a lot as a candidate, because, these millionaire puppets don't have to sit with the patient who's trying to die on you, or hold somebody's hand who just, wants to live. It's not easy being in this field. And after the pandemic, with the shortage of supplies, with the shortage of staff, with the shortage of morale, we saw such a huge death toll from COVID alone. You would have thought that we would prioritize our care, and we would prioritize how we treat people and update and upgrade our systems. And we did not do that. And it's really a sad state of affairs that, we Greens and we independent, activists, media people are the only ones really speaking to that crisis. So feel free to chime in. I think Matt, you ready to add your voice? And then Veronica. You're on mute, dear.
There we go. First of all, the aspect of when you talk about abortion and the control of desire to control people, right? But then you don't take care of them otherwise. And I think the clamoring over young lives, it's just so far removed from the reality of how we take care of people. Like here in North Carolina, it's 1,200 infant deaths a year. So that's 3 or 4 times a day in North Carolina. A mom and a dad, a family leaves a hospital and their infant has just died. Happened 3 or 4 times today. So just the hypocrisy of it, the speciousness of it, the nonsense of it all, the fraudulent nature of the concern, because it's all about controlling people, right? It's all about having control over a population, particularly a population that's different than those who are in power. I think this is part of who we are as human beings, unfortunately, but it's something we recognize and something we can fight against. For me, I get back to abortion. I don't see it as separate from any other aspect of healthcare. And it needs to be included as healthcare. And for me, there should be no conditions on abortion, no judgment on abortion. It should simply be what a woman decides, what she needs for herself. And in order for someone to do that, they need to have a healthcare system. They need to have a doctor they can talk to. They need to have counselors they can talk to. They need to have those types of resources to allow them to get to a point where they can make the decision that's best for themselves, and their family, if that is what needs to be included as well. So, I also too recognize that I'm a dude, I'm a guy talking about this, I find that a lot. We get asked about things that aren't going to impact us. And overall, I mean, one of the things, I don't know how much you all found running, independent third party greens, whenever it's rare when I deal with this in real life. Most of the spoiler type arguments against us, that come from the MSNBC crowd occur online. I mean, I have been all around the States. We do festivals and events all the time. We're out weekends, and everything. And it's rare when we come across somebody who actually throws that argument up against us. What I find overwhelmingly, what I've started to do is I always bring it back to healthcare, that conversation. And that person who's arguing about blue versus red, and that's all that matters, they inevitably always have healthcare, and their people in their lives have healthcare. So, I mean, I think that's something that, we got to keep pulling us back to, is remembering who we're doing this for, why we're doing this, who we're seeking to represent, but also to the totality of, again, bringing it back to the abortion piece, it's part of healthcare, and that's what the conversation should be about. Healthcare is a human right, and it's just as simple as that.
Absolutely. Thank you, Matt.
Yeah, I appreciate what Matt added to the conversation, definitely. And it will take strong men in our community, in our green community, to help stand up and voice their opinions along with the women. So I appreciate Matthew taking such a strong stand for abortion rights. I was born. Oop, go ahead.
I'm sorry. What I was going to say, I thought it was my turn, but you go ahead. I'll wait till you're finished.
Okay, thank you, Veronica.
You're very welcome.
I think for me personally, I was born before Roe v. Wade was in law. So for the majority of my life, and as my children also grew up, they had that right to abortion. So for myself, my personal feelings about what has happened just this year is just shock. I didn't realize that, and maybe other people feel the same, that I didn't know that that was a right that we could lose. And so that has been a wake-up call for me as well, to actually realize that in order for integrity for what voters want, we have to keep repeating what we want. It's not enough to just have something posted somewhere. It's living. It's a living. All of the laws that we have, what's important to us, we have to continue to keep talking about it, why those things are important. And conversely, we also need to be willing to talk about the things that are no longer working for us. And that's really where we are as a nation. I think we're at that tipping point where we're really having hard conversations about capitalism and whether it's healthy to continue to use capitalism as the end all be all. We're also having that conversation about whether a for-profit healthcare system is actually healthy for the size of the nation that we have right now. And all of these conversations that we're having hopefully will bring people to the conversation that the Green Party wants, which is we want the Green New Deal, right? We want people to have the option to make decisions for themselves. And that's why, as a Green, I do support abortion care. It is health care. It should be part of the national conversation around what humans need, period. Thank you.
Thank you, Leona. I think Veronica and then Justin from Connecticut. Go ahead, Veronica. Oh, you're on mute. Sorry.
The disparity of healthcare is just like the disparity of justice and the quality disparity Black women are dying, and the maternity rate of Black women and their children, mortality rate, is just unbelievable. That more people of color are dying. And the healthcare system has done such horrible things to people of color. Like those children, those indigenous children that were found killed in Canada because they tried to make them be white and use that white setting to teach them. And so they weren't white, and they weren't ever going to be white. And so they killed them. The Tuskegee Institute, the way they gave those men syphilis. So people, the healthcare has always been questionable and scary, and they've sterilized a lot of women of color without even their knowledge. They thought they were going in for something else, and they come out and find out they can't have kids. So if we're talking about healthcare and the way it works, we have to talk about the disparity of justice, of everything, because until we would have to build a totally different system. Once you take, I think Justin said that, once you take money out of the equation, we have to build a new system, but one that can work and that works for everybody. And I've been in an abortion clinic. I worked at one in college, and I also participated in my first and only abortion because I wasn't sure how I felt about it. I had to, do my head. But the most important thing in it, I think I told this to Delilah before for our Mother's Day conversation, that I held this girl's hand. She was having an abortion. She thought her boyfriend was going to be there. He was not there. And she was scared. She was frightened. She had the money, and it was about money. She paid the money, and when we went in, she had a vacuum extraction. And I held her hand during the whole process. But I didn't know how I felt about it. But it was her right to choose, and that much I knew. Because we can't, I think I heard it recently, we can't let the government, the room, I think Ralph Warnock said it last night, that the room was too small to have the federal government in a patient's room with the mother and the baby and the family. That everybody doesn't mean there. It needs to be the provider or the healthcare worker or the doctor or whatever. But we need to make sure that everybody's treated the same. And the only way is you're going to have to change everything about the healthcare system. All of that, like Matt said, is included. You can't just isolate eyes and uteruses and reproductive freedom, and all of that is one thing. And so I'm all for it. Everybody needs to control their own body. It's your body. You only get one of them. You should be able to make the choices for yourself, but you have a right to make an informed decision. And a lot of times they are not informed because of the money. That's what I wanted to say.
Well, thank you, because you brought up some very valid points, and I'm grateful because, a lot of women in detention and ICE custody have forced hysterectomies against their will. And, as a woman of color in this very bigoted state, it pisses me off that, somebody might have more say over what happens to me than myself. Teresa has her hand up next. You can go ahead next.
So to springboard off Leanna's comment about how she didn't know that this could be undone, neither did I. I didn't know that this decision needed to be codified. And we had several Democratic administrations that chose not to codify. So now this issue they're just making into a circus. People's real lives are affected by this. And it's been stripped away. The layers have been stripped away like an onion. It's just a fundraising mechanism in our political process. It's going to take a lot of education. That's our everything, the solution is steeped in education.
And
I agree with that.
let me kind of piggyback off of that. That was the point I wanted to make, is that Democrats are culpable, I would say, just as much as the people who overturn it. You can't pretend to be a defender of something and then don't put up a defense for 50 years and say, I'm on your side. Like, you don't have that opportunity to be that. So if anybody's watching and is, I'm going to vote for Democrats because that's going to give me my rights, and I'm saying we need to hold back on that, because if the only time a party is saying they support your rights is in the time of an election, they don't support your rights. That's my final.
Yes, 100% agree with you. Let's see. I think Justin, you wanted to go next. Go ahead.
Yeah, I just wanted to chime in and agree that abortion is healthcare. Legislators are not trained medical experts. They have no business writing the rules of what medical decisions anyone should be making. You know, I went to med school. I mean, there are so many things so many complicated issues involving pregnancy, and it can be a life-threatening condition. You know, there's preeclampsia. There's so many things that are involved, and it's a private matter, you know, between the woman and the doctor, and it's her healthcare decision to make. And I feel very strongly that we should be trusting patients together with the counsel of their medical professional to make their own healthcare decisions. It's just I think we have to take. I take a strong, firm view on that. I don't think this cutting off things at a certain number of weeks doesn't make any medical sense. The people who have medical sense are the trained experts, and they should be the ones, together with the patient, coming up with the best decision for that person. And that's what I trust.
Absolutely. Thank you for adding that. I will just say also to kind of highlight some of the things that you bring up. You know, these binary thinking and old ways of addressing situations are not functional. And, you know, as far as gender is concerned, you don't, you know, your organs don't define your sex. And that doesn't, you know, people who are not women can also have children. And, you know, I would also add that the bigotry and the agenda that both mainstream parties support attacks both women and other people who are, you know, LGBTQIA plus and minorities especially. So it's a very valid point to bring up, you know, the inequalities when we're talking about this. You go ahead next, Liana.
Thank you for Justin for bringing this point back up again. I wanted to make sure that we talked about the fact that if we haven't signed the consent to have our organs harvested after we pass away, there is no law in the US that can compel your family to give up your organs after you die. And just knowing that fact, and then also being reminded that I live in a state that says that someone can only have an abortion if something happens to them. And that is a very sad state of affairs when we start telling any person that they can only have medical care based on our own beliefs about the medical care that they're about to have. There isn't any reason to have bad feelings or good feelings about abortion specifically. I might be sad about someone needing dialysis, but I cannot tell them that they shouldn't get dialysis. That is their decision to get. And so I think we forget that a little bit when we're talking about, different laws. Here in Arizona, we have a 15-week abortion law limit, with exceptions. Although there has not been any abortion care offered in the state since about 2 weeks after Roe v. Wade was turned over. So, because the doctors are specifically afraid of being sued by the Republicans in the state. So it becomes really sad, because we have to remember that there are real lives at the core of each one of these stories. There are women who are making life and death decisions about themselves and the future of their families, and the other people are making it harder for them to make those decisions for themselves. So it's a sad state. We don't live in a country that respects the autonomy of people who have uteruses right now.
Sorry, that does speak to the cruelty of the system, Liana. Thank you. Veronica, did you have something you want to add? I see your hand up.
I wanted to say that with the system the way it's set up, I remember asking a doctor, because I was working in delivery, and I asked why are there so many C-sections? There's C-sections because there's more money in a C-section and delivering a baby than a vaginal birth. And that's insane to me. That's insane, just to do it just for money. And money, greed, and avarice, all that stuff is because of the two-party system. That capitalistic money, and they don't give a damn about people. Republicans don't really care about that people, and Democrats don't care about them either, until it's time for them. Somebody said it earlier, and it's true, till it's time to vote. Then they're all smiles and schmoozing and all that, and that's all of it's BS. That's why I became a Green Party person, because of the way things were. And I didn't, like I said, I didn't know that there were choices, that you could be anything. I'm Black. Automatically, I was a Democrat. And the people next door were white, and they were Republican. So I had no idea that I could be anything else. But I've been green ever since I understood what the green principle and party stand for. And what bothers me and disturbs me more than anything is, if you read all of our principles and doctrines and beliefs, how can anybody not pick that over Republican and Democrats when you see all the memes and all the stuff that's going on? Money is the thing that Mississippi, they have the worst health care, and Brett Favre is getting millions of dollars to put up a ice skating rink or whatever it is for his daughter, with money that was supposed to go for health care. That doesn't make any sense. That's ridiculous. So anyway, that's it. The money is, what is that thing? Money, absolute money corrupts or something, whatever it is. It's true.
Power and money corrupts is,
yeah.
Mm-hmm.
Absolutely. Yeah. So that's it.
That. Well, we've been on for about an hour. I don't know if you guys want to make some closing arguments, or bring up some topics that are, really important to you. Just gonna leave it open. Oh, maybe we should go longer. I don't know.
Did you see that link I sent?
No, I did not, Felina. I'm sorry. Let me check it out. I'm gonna pass the mic to, oh, Veronica. Okay, I understand. Well, thank you for coming, and I hope you have a good night. I'm gonna miss you. We'll talk soon, okay? Love you. Bye. I can't hear you.
Say it was nice meeting all of you on the panel. I want you all to win your campaigns. I love you all, and take care. I have to leave, but thank you so much for everybody participating. Ciao.
Bye. Thank you. Good
Thank you,
night.
Veronica.
And also, I'm gonna be checking out. Gotta go pick up the middle daughter from volleyball practice, so I'm gonna go
Okay.
do that. But this was a great panel. This is the thing that we have to do. We have to start out step by step with these panels, and then the panels turn us into conferences, and the conferences turn into movements. We just got to keep moving because movements die when we stop moving. We have to keep moving.
Thank you,
So
Jay.
that's my final comments, but keep fighting, power to the people, and I'm gonna leave you.
Thank you,
Jay.
CJ. Have fun with your family. Good night.
Good night. Bye, guys.
Bye. I'm just gonna add real quick. I worked with RBN back when started to get my feet wet with the podcasting, and I should be better skilled at this, but I am not. So I appreciate you all being here and being patient. So I'm just glad that we're all here together. It's really important to understand, that that's a very fair point. Without movement, movements die. So we are here making the movements, and we're not going to stop. So let me just go ahead and pass it off to Matt. You can, if you're ready.
Sorry. There we go. Yeah, and to follow up with what CJ said about our movement, and I think the next aspect of that, we always got to bring it back to what our principles are. And so we're green, we're socialists, we're on the left, and for me, I've been reminded of this. I was reminded of this because of what Liana said about dialysis. Because my grandfather, he was 89 years old, my mom's dad, and he went to dialysis one time, and he said, "No, I'm not doing this. I'm not getting hooked up to a machine every 3 times a week or whatever it is." And they said, "Mr. Muria, you'll be dead in 3 weeks." And he said, "Okay." And he was able to choose how his life ended, and he did it with dignity, and they had respect for him. And that was all able to be accomplished because he had the healthcare system that worked for him at that point, right? He had Medicare, as well as he worked for Otis Elevator for 50 years or something like that, right? So he had that available to him. And for me, this idea of continuing to come back to human dignity, right? Human rights. Healthcare is a human right. I mean, just continuing to bring it back to that. And if we are doing what we can to ensure that all people have that access to dignity, that we are actioning that human rights, healthcare is a human right, to action upon that. I think that's what we have to do in this movement, is continue to come back to our principles. Don't get distracted. Don't lose track of what we're doing. Like keep that emphasis on who we are, because that really separates us from all the others out there, right? I mean, we don't hedge, we don't cut corners, we don't say what we don't mean. But this has really been really great. I've learned a lot, the perspectives. I'm really glad this was done tonight. Thank you, Delilah, and Justin, and Felina, and everyone. Everyone for being on and for putting this together. So this was really, really terrific, and hopefully we can do more of them.
Yeah, thank you so much for joining us. I'm really glad. You can, Justin, if you want to go next.
Yeah, I just wanted to thank.
Okay, Matt. Can you hear me okay?
Uh-huh.
Yeah, I just wanted to kind of building on what Matthew was saying and just say, I'm very happy to be in the Green Party. I think I see us as we're the political arm of the peace movement, the economic justice movement, the environmental and climate movement, healthcare justice movement. Like and we are the political arm. We are, those ideals of justice in political form. Like, we believe in these things and we fight for them, and that does set us apart. And I think when voters in my district, if they look at their ballot, they're going to see the Republican, which I don't think has anything to offer. The Democrat, which may have some things, may be good on some things.
Oh,
Let's just say that
we can't hear you.
cut out there.
Oh no.
With the way we have our ballots, that
Could you
feel they
speak
have
up
to
a little
vote.
bit, Justin? You cut back out.
Oh, darn. Can you hear me now? Oh.
Yeah, maybe if you slow it down a bit, because I think it's just a live stream. So go ahead and we can hear you now. Oh. I'm not really sure what happened, so I'm gonna come back around, and Liana, you can go next. And thank you, Justin, for speaking on this. I'll get back to you.
Closing comments. Thank you so much for putting on this panel, allowing us to speak to the audience of Greens, and hopefully others will join this movement. I appreciate that the Greens that are on this call who are exercising their negotiation skills. Justin, who is negotiating with his internet right now. So I think I want to just echo everything that Matt said is so true. Greens are truly at the forefront of making some things happen in our society that we really need. But we're also not the individuals who are going to force everyone to do it that way. So we're at a crossroads. We know that we have the right plans that would help the majority of people, but we need people to be able to implement those things. So it means that we have to keep talking about this, and we have to keep showing up to tabling events, and we have to keep showing up to run for offices and show what being green looks like. So I really appreciate everyone's time. I really appreciate and honor everyone's story who shared this evening, and I really appreciate it. Thank you.
I was on mute. Thank you so much, Liana. I appreciate you being here, and thank you for running also. Thank you all for running. Teresa, did you want to add anything before we wrap it up?
Sure. I used to be a really healthy person, so this is really challenging to realize firsthand how people are treated who don't have insurance. I went to my surgeon's appointment and they wanted $200 before I saw the surgeon. And I said, when I got my biopsy, I was able to put a card on file and ask the lab to run my charges past my insurance first, and then take what I owe off the card. And they were okay with that, but not the insurance. Not the surgeon's office. They wanted me to pay in full right now. And I said, so, what's going to happen if my insurance company negotiates a better rate? And I was told they'll just keep it on file as long as I'm a patient of record. So not only am I prepaying, I'm overpaying. But I wasn't going to get to see the surgeon unless I gave them money. And that became very clear to me that if I didn't have the wherewithal of a card, I would be turned away even though I have cancer. And that's the reality for a lot of people. And it's totally unacceptable. We have to keep fighting. It's not really a political party issue, because everybody needs health care, and we just have to keep educating people. So with that, I'm off. Thank you for inviting me and including me. I appreciate it. Be well and happy.
Thank you so much, Teresa. I really appreciate you sharing your story with us and everybody listening. It's important, and you're right. It's not just a political issue; it's a human rights issue,
Yeah.
and I agree with you there. So thank you so much.
You're welcome.
I wanted to give Felina a chance if she wanted to add anything else. Or maybe she's busy. That's okay. Justin. Oh, there you are. Hi.
No, I didn't have anything else to say. I had a closing video, but I don't know if you wanted to play it, so I'll just finish cooking here.
Oh, okay. Yeah, sorry. I don't know. I don't think I have that ready. Oh, yeah. Do you want to did you want to add anything before? Because I think I only have a few more things to say. Well, I mean, me personally, you know, being a mother and a healthcare worker and a candidate also, I have the unique perspective that I have been a patient advocate for as long as I've been a worker in the field, and I was trained to do that through my job. And because I was trained to do that, I was able to familiarize myself with what rights we had as patients and make sure that other people knew that they had every right to exercise their rights. And I think with this trajectory that we are experiencing right now, it is essential that we keep fighting for our human rights. And I can promise you that even if I don't get elected, I am sure as hell going to show up to make sure that this fight continues, because I'm not giving up on that. And neither are the doctors and nurses and other healthcare workers that care about people having access and care that they need. And they shouldn't be means tested or punished by these barbaric systems to access that care. We need to make sure it's a human fundamental right for everyone. So that's really all I had to add. And I thank you all so much for your time and energy on this. It's very important, and I'm really grateful for you all. And yeah, just love and solidarity to you, and good health.
I'm going to once again point out to the people watching this on YouTube or maybe on VOD, that's Delilah, your website, delilahfortexas.com. Matt, do you want to plug your website here?
Yeah, it's matt4senate.org. It's the number 4. So matt4senate.org.
And
Thank you.
Liana, do you want to plug your website as well here? Got to give our candidates a shout out here. You're going to have to unmute though.
Thank you. I appreciate it. I'm most active on Twitter, so it's LWest, the number 4 AZ. And my website is West 4 Arizona. You can find me on attached to the Arizona Green Party website as well. So
excellent.
We're looking for a debate here in Arizona. We haven't had one for the governors, so if anybody is interested in helping to host that,
I would love to. I don't think Kari Lake would love to talk to me though. That's I wanted to point out, if anybody's watching and your state isn't represented or wasn't represented here tonight, you can go to gpelections.org and go look for your state and find out which one of our great candidates is running in your neck of the woods. And if you want any more information about what I'm doing over here in Maryland Green Party, that's mdgreens.org. If you want to find out what we're doing nationally, of course, gp.org. And if anybody has anything else to say, I think our next step is going to be. Okay, Teresa, you got something to add here as far as
all right,
getting us off here before we play
quick
this,
plug
this clip
for
here?
Yellow Vest Actions Phoenix. I have my signage, some of it behind me.
Okay.
I keep 60 signs in a box along with 60 yellow vests and a bullhorn. And we like to stop up out in front of the senator's office. I'd really like to get one going around 7 to 7:30 a.m. for anybody in Phoenix who would like to join me. I put a link in the chat. You can look at our YouTube page at Yellow Vest Actions Phoenix. It's got some recent videos for a press event to stop the privatization of Medicare. So please check that out. Drop me a like if you like. Thank you.
Excellent.
Absolutely. Thank you too. I will try to add everybody's links to the Twitter posts. And yeah, I'm so happy that we got to spend this night together, you guys.
Delilah,
You're all wonderful people. What's up?
If you want me to try to do the video, Delilah, we could use that and send everybody off happy here.
Okay, sure. Sounds good.
Right,
Everybody okay with that?
Cool.
Let's see if this thing works here.
Thank you all again. Let's see.
Okay.
What are we doing now?
He's supposed to be showing a video.
Oh, okay.
And I'm adding links to our Twitter feed.
All right. Okay.
There you are.
Let's see. This should have sound.
And it's okay if, I mean, we can always add things to the threads later if it's, you know. I'm going to add links. But yeah. Anybody else has anything? Actually, before we leave, I wanted to make a point that environmental racism and healthcare are directly linked, and the environmental crisis that we are experiencing is effectively shortening our quality of life and our life expectancy. So I kind of, I do feel that sense of urgency, at least among like-minded individuals, and I'm really happy to meet other activists and other rabble rousers, because we need to be out there as much as possible. So thank you. Any luck on that video?
It's all very much intersectional.
Unfortunately, it doesn't look
Lack of housing affects our health care.
Absolutely. You're absolutely right. You know what? I think we're just going to end up adding the video to one of the threads. And yeah, if you guys are, I appreciate you all being here. And once the recording is finished, I'll send it to you.
All right, well, thank you.
It doesn't look like we're going to get the video working as it doesn't have any sound, but
that's okay.
I'm very glad that everybody came out here. And as I said, gpelections.org, gp.org. Let's go. Let's get some Medicare for All fighters in this November.
All right, good night.
Good night.
Thank you. Good night.
Night, everyone.